that didn't work.
Hello, we are a team composed of a medical student, pharmacy student, and multiple coders. Here is our experience. Have you ever been prescribed a medication and told that yes, there are side effects, but the benefits outweigh them? How often did a doctor sit down and explain the different side effect rates of the different options available to you? As is often the case, although important, side effects are the least talked about portion of drug selection, but is one of the leading causes of patients to stop taking medication. With precision medicine, not only should side effect profiles list rates for the general population, but should have further analysis that shows rates for specific patient biometrics. We created a crowdsourcing platform for patients to build community and provide transparency in side effect rates. Patients are able to enter in demographic data, side effects that they've experienced, and whether they would recommend the medication to others. This not only gives a voice to patients, but also provides patients and doctors with data to help choose the therapy based on patient factors and preferences. For the purposes of this weekend, we focused on birth control as a test population. Patients enter in the demographic data, then they select what medication they've used and side effects they have experienced. In the future, more specific parameters will be in place to better analyze subpopulations.
So one of the big questions of this model is, will patients actually be willing to crowdsource this data? And the answer is overwhelmingly yes. We sent out the survey last night and got over 100 responses in just a few hours. You can see we've graphed some of the preliminary data. So here you can see the responses sorted by birth control type. And this actually roughly tracks with how common these are in real life. So you can see IUDs, pills, etc., other forms of birth control. The next question you might ask yourself is, how will patients actually use this data? Well, a common issue is when you have so many methods available, how do you decide which one to choose? Often people are trying to minimize side effects. For example, if you're trying to avoid weight gain with a birth control method, then you can look at this data sorted by IUDs and pills, and you can see that for pills, more people experienced weight gain than did for IUDs. So that may encourage you to try IUDs instead. Ideally, we would want this interface to be interactive with the patients so that they can filter the metrics by people in their demographic who are most like them, and also look at side effects that are most important to them to avoid. So you can see here, you have the options to filter by any drug or category, your own demographic information, and what variables you're looking for example, the side effects here. And sometimes there won't be a big difference in outcomes between options or between demographics. That's fine. This is about personalized medicine, but more than that, it's about building transparency, community, and patient confidence in making their own healthcare decisions. This data platform would be uniquely by the patients and for the patients. When I sent out the survey last night over Facebook, I got dozens of messages thanking me for working on this and saying how badly something like this is needed, especially in women's healthcare, in which side effects and suffering are often dismissed, with too few resources for women wanting to learn more about them. The time for something like this to exist is now. Thank you for your time.